Good afternoon, everyone. This is Dr. Bhupesh once again for you all. And please subscribe our channel if you have not. For the best OET coaching, you may contact us on 76967 34256. And the Indian code is +91. And talking about the listening module today, so you guys have told me to do this listening. This is of Peter Parker. Again, we don't create question papers. Being Dr. BKM, we only tell you how to solve when it comes to OET listening. But before we start this paper, I would definitely like to tell you few key points, which I believe would be very handy for you. Very handy because sometimes people work too hard, but they do not understand the calculations. So yeah, okay. So it's not aligned. Yeah. So most important thing is calculation. When it comes to OET listening, you need to understand, guys. First of all, I will tell you the important thing according to what you should know. First thing you should know is that it is not necessary that you have to score 32 out of 40 to pass. It is not necessary. If the exam is difficult, even the person who is scoring 30 may pass. Even the person who is scoring 29 may pass. If the exam is easy, then the cutoff obviously can go to 32 to 33. Now, what is the benefit of telling you this thing? Benefit is that suppose if your exam is difficult, you are sitting in the examination hall, your exam is difficult, and in the listening part A, you miss out on three questions. Suppose there are three questions in a row, question number three, question number four, question number five, which are very difficult, and you miss it. Then you should realize if the question was difficult, if listening was fast, that means everybody would have missed it. That means where we were thinking about scoring 32, today 29 can be passing marks. The benefit is that psychologically you will feel very strong in a way that three questions were difficult, everybody would have missed it. So it does not make a difference. But when the exam is difficult, if you are not positive, then you lose hope. The person who is not positive, after losing third question, fourth question, and fifth question, he will feel like, oh, today I will not pass. So what I mean is that cutoff will go down. So the people who are positive have more chances to pass because anxious people will not be able to perform up to their potential. And if you behave strong, even if you do average, you will pass. So when the exam is difficult, the chances are more of passing even if you perform average. When the exam is easy, competition would be more. If exam is difficult, don't feel that, oh my God, I will not pass. Feel that today is the best chance because most of the candidates will lose hope. They will become anxious. They will perform less than their normal potential. So today is the best chance to pass. That is what is the benefit of understanding the scoring. So normally 30 to 32, 30 to 32 person who scores it will pass. First thing. Second thing in listening part A, please understand, do every listening at least two times because that is where you learn. Sometimes don't take the question paper, just listen only to become better at understanding accent. If listening is a problem for you and your reading is good, that means the problem is in the listening, means that you do not understand the accent. For that, sometimes do not pick up the question paper, just listen. This will improve you a lot. If you will listen two times, the first time the lines you were not understanding, you will understand the second time. That means it gives you lot of advantage to listen in a better way. Listening will improve if you will repeat it. Don't do listening one time. Do every listening at least 2 to 3 times. Out of the results which I have sent you, there is one person I will not name because it doesn't look nice. The last time she scored 300 in listening module, the only advice she remembered, I said, ma'am, you need to do listening three times, one listening three times. Then she said, sir, I never did it. Maybe that is why. I said, ma'am, yes, it is true that you did not do one listening three times That is why it has happened. This time she has scored 380. I have forwarded you the results. She has scored more than 350 easily. Just understanding one advice, that do one listening 3 times. Because the things you are unable to grab in the first round, how would you learn about them? When you will listen to it again, then you will become better. So scoring is very important. Doing one listening at least 2 times. If you can do 3 times, then you are the best. And if there are like 1 to 5 questions which are correct, then don't do that patch again. Because if 1 to 5 are already correct, why you are doing that patch? You can leave that patch. You can start from question number 6. In this way, you will save time at which as well as you will do listening 2 times. So when you, if your 1 to 9 questions are correct, don't do them again because they are correct. Why to do them again? So you can save time as well if time management is a problem. So these are very small instructions, I know, but these are the main instructions to pass. Do one listening 2 to 3 times. Even if you will do 10 listenings now, you will pass. If you will do one listening 3 times, total of 10 listenings, you will pass. Nobody can fail you. But if you do one listening 3 times, one listening 1 time, and even if you do 30 listenings, they won't help you. Doing it again gives you the power to understand more, to get into the deeper words. Third, practicing spelling. Very, very important. Now you must know about the spelling rules of listening. In OET listening part A, spellings are very important. But if it is, suppose if it is Addison's disease or it is Alzheimer's disease, then this spelling by chance, if you do wrong, they will give you marks. But still, why, if there are common diseases like Addison's or Alzheimer's, don't do them wrong. But by chance, if there is some typical disease on the name of a person, then they will give you marks. Suppose by chance Crohn's disease. So if by chance you write Crohn's disease, so they will give you marks even if the spelling is wrong. But if you know the spelling, don't do it wrong, but they will give you marks. In the same way, if there is any drug name, suppose if they are talking about amoxicillin, amoxicillin is a drug that has the combination of clavulanic acid and amoxicillin. So amoxicillin, this spelling you can do wrong, they will give you complete marks. But amoxicillin spelling cannot be wrong. Means short name you can't do wrong. Diabetes mellitus you can't write wrong. Like in this way, if I write diabetes mellitus, I will not get marks. I have to write the right spelling of diabetes. Only then they will give me pass. They will give me marks. So common spelling mistakes like hypertension, diabetes, these you will lose marks if you do not write it well. You don't have to write in the capital letters. You can write this way. But again, your writing should be very much nice and it should be comfortable to read. Because sometimes if you're doing very well in OET listening, but you are not getting enough marks, that might be because of the not writing it neatly. Writing neatly is very important. So when you practice listening the second time, then you increase your speed, and that is where you can improve on your writing as well. If you do listening only one time, you just keep on doing it, you don't understand what is right and what is wrong. When you do it second time, that is the chance where you can improve your spelling, you can improve your writing method, the neatness in the writing. So these are very, very important instructions. Now the final thing, most important thing. Everything is important, you can't miss out on anything. But considering the last important point, scoring. You get 24 questions in the listening part A. We should always try to fetch 20 to 22. This was the another thing that I discussed with that ma'am. She said, "Sir, the advice that you gave me, how did I take that advice? I understood that I have to score minimum of 38 before I jump onto other listening." That was the only thing she understood when I said that you should do listening 3 times. She said, I made it simple that unless I get 38 marks in listening, I will not do the next listening. So in every listening, I started scoring 38. So 36, I think, should be the minimum marks before you jump onto the next listening. So if you are doing one listening, you are getting 28 marks. Then you do another listening, you again will get 28 or 30 marks because that is your average potential. if you want to improve the potential, you will have to repeat that listening and take it to 36 to 38. So that is the logic. So try to score 36 in one listening, then jump on to any other listening. Again, very important. Now in the A part, if you get 24, 20 to 22, we should try and score. Then you will definitely pass. If your spellings are good, if you are scoring 20, more than 20 marks in listening part A, nobody can fail you. Because in the part B, you will get 6 question. In the part C, you will get 6 question. In the part C2, you will get 6 question. So even if you score 6, if you score 4, 4, 4, you will still score 20 plus 12, 32. Means nobody can fail you. Nobody can. If listening is a problem for you, you just have to score 20 in this. 4 marks you will get in part B. If you are a normal average listener, you will still get 4. Because suppose if 3 questions, now I will tell you the trick when we will execute the listening. So I'm now going to jump onto the listening. Let's do a listening and then we will discuss about it. Some listenings are good, some listenings are bad. Bad in a way, not in a way that they are bad, but in the paper they will come in the sequence. So today, most of you have told me to do this listening. So I believe it should be difficult. But if it will not be difficult, I will let you know. If it would be difficult, then also I will let you know. Thanks to the institute who would have prepared this question paper. Again, my job is to tell you how to do it and what are the main instructions. So now I will do it practically in front of you and you would be able to learn. Let's do it.
Complete the notes with a word or a short phrase. You now have 30 seconds to look at the notes.
Always listen to the instructions carefully. Now he has given me 30 seconds. I will read it for 30 seconds. In 30 seconds, you try to understand what is the topic of the day so that your subconscious mind can be active. Peter Parker, 15, student, chief complaint. So the first question is about chief complaint. Details of the incident occurred while whilst means while patient was dash one bunk bed to another. Patient was jumping from one you your subconscious mind becomes active. So I believe that patient was jumping from one bunk bed to another. Maybe I'm not quite sure. Occurred 2 years ago, 3 years ago. They must be talking about timing. Further inform feels sharp pain in dash, had a bruise on dash caused by the landing. So bruise must have happened on ankle, leg, knees. If he's jumping, so most probably legs would be involved. I'm not quite sure again, but your subconscious mind starts thinking what it can be. So you have to name the part of the body. You have to name the part of the body. You have to tell about how did it happen, when it happened, chief complaint. What is the chief complaint? So now you know about the topic. Provided dash to the affected areas means provided therapy, provided heat, provided ice bags, something like that. Explain that patient can substitute this with, that means if patient wants to change this medication to something else, then there would be another thing. Patient keen to resume running, swimming, whatever he must be doing. But it would be a physical activity, because if he's physically injured, he must be thinking about resuming physical activities like driving, something like that as soon as possible, but advised to wait for dash. So there must be some time. Provide dash, will dash for an X-ray. Will next steps is like will go for an X-ray, will undergo an X-ray. Provide dash, provide advice, something like that. So now you understand the topic. Obviously, in this, the main uh, disease is not given, main condition is not given, but I can understand the topic is about injury, and that must be a physical injury. So my mind starts activated. So I will get 30 seconds. I have read all the questions by the time he will start speaking. So I'm putting it 30 seconds forward now. Okay.
Come on in, Peter. I've asked your tutor to wait outside for a bit so that the two of us can have a real chat about what's happened. I hope that's okay.
That's fine. Mr. Engelman's just being a worrywart. I already told him that I'm fine. I just hurt myself is all. Look.
Oh, wow. Peter, that's a nasty bruise. How did you manage that?
It's more than a bruise, nurse. I had an x-ray earlier, and the doctor said that my arm is broken.
Oh, dear. How did you manage that?
Have you ever seen any of the Spider Guy movies?
Sure.
Well, in the second one, about halfway through, there's this one scene where he hangs off of the Empire State Building when he's being chased by Lido. Well, I share a room with my little brothers, Prentice and Polly. Prentice was Lido. Polly was a cop, and I was.
So see, until now, even I have not been able to figure out even a single. Chief complaint should be told by the patient, but in this, doctor or the nurse is saying bruise, and the patient is saying broken arm. So again, we are confused. Even you are confused. So listenings like these normally will not come in the exam. Normally, cat will not come in the exam anyhow. But what I'm saying you until now, even I don't understand even a single thing. If it is being said or not. So these kind of listenings do not come in exam. And also the listening will always be in the sequence. It will never break the sequence. So until now, even I don't know anything. If I have to fill one thing, chief complaint, I will try to fill what is being said by the patient, that is broken arm or fractured arm, something like that. But until now, even I have not got anything. So you need to have patience and then you learn from it. But don't, if something like this happens in the exam, which will not happen, it will not be that difficult. But if something like this happens, then again, please remember my words that if listening would be difficult, cutoff will go low. Don't panic. Today, many people will lose heart. If you are the one who can be brave, you will pass. You have more chances to pass. It's just about controlling anxiety. So let's see what we can do. Until now, nothing. Let's see it.
Guy. Anyway, Polly. Prentice was Lido. Polly was a cop, and I was Spider Guy. Anyway, at around 7 a.m. this morning, I jumped onto my bunk bed trying to swing off of it into Prentice and Polly's, but missed, fell down, and landed badly on my side.
So now, as per the rules, occurred at 7 a.m. while patient was jumping from this I have to fill. Means if it is not given, then I will say that they have not done it right. But patient was, I have to put ing. This is what they want from you, that you have to do it yourself. Otherwise, patient jumped from one bed to another. Patient was jumping. So you have to put past continuous. I don't find any other thing. Patient was jumping from one bed to another. So I have to fill these words myself. This is what they want. So that is the only word I can fill. Patient was jumping, occurred at 7 a.m. or 7 in the morning. You can't say 7 a.m. morning because then you will lose marks. Because again, as per the rules of English, either you write AM or you write morning. You can't write both the things. Some people can lose marks because they will write 7 a.m. in the morning. It's wrong. 7 a.m. or in the morning. This is English rule because AM means morning only. So you don't have to write it. So chief complaint, most probably fractured arm or broken arm, occurred at 7 a.m. while the patient was jumping from one bed to another. So 3 questions until now. I think it should be right. Rest we will see later. Let's go ahead.
Polly's, but missed, fell down, and landed badly on my side.
Oh no.
That's not the worst part, nurse. I have a real stinging pain on my left elbow, and it's not just this bruise.
In my left elbow. So that is again. Now again, if you write, these are the small things maybe people do not understand, and that is where they lose marks. Feels sharp pain in my left elbow, then you will lose marks. Because you are preparing the case notes. You hear a nurse talking to a patient, complete the case notes with the word. You can never use the word my. Some people, I don't know, you would not do that mistake, I agree. But maybe you are the one who is committing this mistake. Feels sharp pain in my. My means wrong. You have to prepare. So sharp pains in the left elbow. Write only this thing. Or don't take the risk of in his left elbow, her left elbow. Don't take the risk. So in left elbow. That is another thing done. So feel sharp pain in left elbow. Fourth question, almost done until now. Okay, I will.
And landed badly on my side.
Oh no.
That's not the worst part, nurse. I have a real stinging pain on my left elbow, and it's not just this bruise. My thigh's got a nasty one on the same side as well.
Well, I guess you and your brothers won't be playing that game again.
No, sir. It wasn't even my idea in the first place. But I've learned my lesson.
I hope so.
So had a bruise on left thigh. Left thigh. Why? Because the person said that on the same side. So should be on the left thigh. But even if you write on thigh, even then you will get marks. At thigh means over here is a noun. Left means you are describing which thigh. So the other word left thigh is not that important, but at least thigh word will fetch you marks. So THIGH until now. Again, I don't know whether it would be right or wrong, but I'm doing in front of you. We will check the answer later. But I'm more interested in learning rather than in judging myself. Means knowing the answer is the second thing. First thing I want to do best. For that, even before I check my answer, I will try to do this kind of listening 2 times before checking the answer. So anyhow, let's play it again.
My thighs got a
That is the main mantra of learning. When you check the answer, you learn nothing. You only judge yourself. Okay, out of 12, I scored 7. No learning. But if you would not have checked the answers, if you would have done it again by yourself without checking the answer, the next time you might have scored 10 out of 12. So that is power. Power is in repetition without checking the answer. If you can control your curiosity to know where you are, rather your curiosity should be on improvement, then you will definitely score higher. Again, playing it again for the convenience.
Prentice and Polly's, but missed.
Sorry, a little.
Oh, and it's not just this bruise. My thighs got a nasty one on the same side as well.
Well, I guess you and
This is what I listen. Even in the first time, I can listen to this word thigh on the same side. So that is how good your listening should be. If you are looking forward to getting 450 or A grade, then you should be at that level to understand each and every word being spoken. And how would it improve when you will do one listening 2 times, 3 times? Then you will be able to listen all the words, and that is how it will improve.
others won't be playing that game again.
No, sir.
But
It wasn't even my idea in the first place.
But I have learned the
But
lesson.
I've learned my lesson.
That is how I clearly understand listening. I have learned my lesson. I remember these lines now. This is how good you should be if you are looking for a definitive score of A. If you're looking out for B, still you have to work hard on it. So, yeah.
I hope so. So, Dr. Gessens asked me to check the fit on your cast and to make sure that you get a cold compress too.
Is that like an ice pack?
Yes, it is. It'll slowly get warmer when it adjusts to room temperature. But if you find that that happens and you're still feeling the pain, then you can still get the same sensation by using a frozen bag of peas or something similar from the freezer at home.
Frozen bag of peas. Frozen bag of peas. If ice melts due to the temperature, so provided ice packs, which I already expected. I swear I did not have any idea. I was considering heat packs, this and this. But that is what subconscious mind does. When you understand the topic, you guess the words and then it becomes easy. Okay?
Thank you.
You're welcome. I mean, I can see it.
Okay.
It's that Dr. Get
Okay, I will listen to it.
by using a frozen bag of. It'll slowly get warmer when it adjusts.
But I've learned my lesson.
I hope so. So, Dr. Gessens asked me to check the fit on your cast and to make sure that you get a cold compress too.
Is that like an ice pack?
So you get a cold compress too. Cold compress too. Cold compress.
Yes, it is. It'll slowly
Ice packs. Okay?
get warm. Dr. Gessens asked me to check the fit on your cast and to make sure that you get a cold compress too.
Is that like an ice pack?
Yes, it is. It'll slowly get warmer when it adjusts to.
Try to write whatever is being spoken. If they are talking about singular ice pack, then write as ice pack. I'm not saying if you write ice packs, it will go wrong, but still try to write what is being spoken. Ice pack in singular, ice pack. Provided ice pack to the affected areas, but areas are given in the plural. So now you can use both the things, ice pack or ice packs. That's fine. Okay. Provided ice packs to the affected areas, but 2 word is not looking nice, but we don't have option. And patient can substitute with frozen bag of peas. Okay, done.
Temperature. But if you find that that happens and you're still feeling the pain, then you can still get the same sensation by using a frozen bag of peas or something similar from the freezer at home.
Okay. Thank you.
You're welcome. I mean, I can see on your notes that Dr. Gessen's already prescribed you with painkillers. Is there anything else I can help you with today,
So
Peter?
now again provided word is being spoken. But if I fit the word provided painkillers to the affected areas, it is not looking cool. So you should understand that which word is fitting in. So, but I will listen, I will try provided painkiller, but to the affected areas now. If they would have said provided dash for the pain, then I would have written the word painkillers. And I do not change the word in listenings that I will not change the word painkiller with analgesics. No, never. Write what you listen. Don't change it. Okay.
Nah, unless you know how to make time go faster. I really want to be better. My mom won't let me ride on my bike or skate, and it's such a drag. Why do parents have to be so strict all the time?
So mom is not letting me drag or this or that, skate or ride. So patient keen to resume riding and skating until now. If I do not get a second chance, I will make you listen to it again.
I know that what I did was to be better. My mom won't let me ride on my
I mean, I can see on your notes that Dr. Gessen's already prescribed.
Patient keen to resume means what is the desire of the patient. Keen means what does he want. So then patient keen to resume. Now he will speak.
With painkillers. Is there anything else I can help you with today, Peter?
Nah.
And also you need to understand small things. I'm telling you, I know I'm taking a break again and again, but then if I'm doing work, then I should work hard. Sorry for making it little boring, but when there is a word like ing, these are kind of nouns. They are known as gerunds, but you don't have to remember that it is a gerund. But now they want words with ing. They want some noun in it. So you can't say skate. Patient keen to resume skate. Skating. Ing should be there. This is gerund. This is a noun. So that should come. So small things again. Sometimes we do not consider these things, but again, we should know that if one word is in ing, that means they are expecting others to be ing as well, or maybe a noun. So there should be a noun. So not skate, it should be skating, riding. That small things again. Some people might be taking, because I take these things for granted because I have been taught in the childhood, I don't commit these mistakes. But if English is not your first language, until your matriculation or until your 10th exam, obviously you will not be knowing it. So small things like this. And in this, if you can, he said, feeling stinging pain in. So the main word that confirmed me that I should write over here the word, whatever we feel sharp pain in, whatever word we did, left elbow, I guess. So in word was very important. Prepositions are very important. So I was concentrating upon the word. He said stinging sensation in word was important. That is what told me I should fit left elbow. So prepositions very important. In this we learnt about the tenses. Was jumping, ing, past continuous. Otherwise was jump wrong in tenses. Means was jump is not a sentence. I was jump. I was jumping. So that is important. So that is this listening is teaching us how to change grammar according to grammar, how to notice,
Unless you know how to make
how
time.
to notice prepositions. Even in this area, two word was important because I have to fit in some word. Otherwise, painkiller could have come, but painkiller is not fitting with two. Provided painkiller to affected areas is not fitting. You have to notice these small things. And that is how you would be able to do it better. And this again, running, skating, this is important. Let's listen to it again.
Faster. I really want to be better. My mom won't let me ride on my bike or skate, and it's such a drag.
Bike or skate. So biking or skating becomes my answer.
Why do parents have to be so strict all the time? I know that what I did wasn't the smartest thing I've ever done, but this is a little harsh, don't you think?
I don't think your mom's trying to punish you. I mean, what did Dr. Gessen say?
He said the same thing pretty much.
I think they're both just worried that the increased physical activity might make your injuries worse. It's good advice, Peter. I would lay off the extracurriculars and concentrate on getting better. When you're feeling better, do me a favor.
As soon as possible, but advised to wait for two words, either physical activities or extracurricular word. Extracurricular is a small word which normally is like extracurricular activities means extra And when we do the academic part like mathematics, science in childhood, these are according to curriculum. CURRICULUM, that is academic curriculum. When you do extra activities, these are known as extra curricular, that is out of the curriculum. Extracurricular activities. So again, this is a harsh word, but again, physical activities was another word that is big. But again, when doctor advised, he advised for wait for extracurricular activities. Again, I will make you listen again so that we can learn.
He said the same thing pretty much.
I think they're both just worried that the increased physical activity might make your injuries worse. It's good advice, Peter. I would lay off the extracurriculars and concentrate on getting better. When you're feeling better, do me a favor and call in and ask Dr. Gesson for his say-so and further advice.
I will. Nurse, can I get a sling? Then everyone will know that I'm hurt, and it will look way cooler that way.
It's a good idea to rest it, so I'll see what I can do.
Thanks.
You're welcome. I'll ask for you to get an appointment to come back to see Dr. Gesson in 4 weeks' time for another x-ray to make sure that everything's healing nicely. It'd also give you a chance to get a new...
We'll wait for 4 weeks, I guess, for an X-ray. We'll get an appointment for an X-ray. 2 words can come in. We'll get an appointment for an X-ray or provide sling. Sling is the word that they were talking about. Provide slings, and we'll wait for an X-ray, or maybe we'll wait for 4 weeks for an X-ray. This is also fitting it. Or we'll book an appointment for X-ray. Book an appointment would be a better word. I will write it simple, but again, it can be otherwise. So out of all the blanks which I have done, I feel otherwise, if I think my exam, I would say at least 10 should be correct. But again, I'm confused about extracurricular or physical activities. I'm confused about this, and rest I feel pretty much okay. So would check the answers, would take your advice as well. Your comments, please. Now I'm unmuting you. So first answer is, guys,
Broken arm, sir.
so that's cool. Fair enough. Broken arm is done. Then, because again, that was also not easy. You need to understand that what doctor was saying is not important. Chief complaint should be told by the patient. That is why I say that OET cannot be taught by anybody who is not a medical professional. Because not everybody will tell you that chief complaint would be told by the patient. This is a small logic, and we all know that. But sometimes we do not give weightage to this thing. We just write whatever doctor is saying. No, give weightage to what patient is saying when you're talking about chief complaint. This is what coaching is all about. Now let's see others. Second,
Excuse me, sir.
yes, please, ma'am.
Sir, arm broken is right or not?
No, ma'am.
Okay.
Arm is again, see, arm is a noun.
Yeah.
And broken is an adjective that always comes before because it tells what is happening. We can't say
Okay.
girl beautiful, boy
Yes.
handsome boy and a beautiful girl,
Okay.
and how it goes. Again, it's good to ask because sometimes we do not consider these things. But obviously, when we're talking about a chief complaint, it can't be arm broken. Broken.
Okay.
Yes, it's very important to write it that way. Otherwise, again, we will lose marks without anything. Okay, next. And then what is second?
7 a.m.
Perfect. Patient was
Swinging from.
jumping word was used. Patient was, I'm not quite sure, but jump word was used. Swinging, I'm not quite sure. I didn't listen to maybe, but that is, if you even if they have not used the word swing, we should not do it. But jump word was, I think, was better. But okay, that's fine. Next, feel sharp pain in left elbow. That is 100% correct.
Yes, sir.
And bruise on left thigh or just thigh?
Left thigh.
Perfect. See, now these are the small things again. So if you're better at it, obviously you will write better words. That is what I'm saying. On the same side, that means on the left thigh. This thing is a trademark to learn. Obviously, we will wish this kind of harsh listening should not come, but you should be prepared. You should learn how to do it. That is what is the motive of doing practice before taking your exam. Okay. Now next, provided dash to the affected area, ice packs.
Yes, sir. Ice pack.
Substitute with the frozen bag of peas.
A bag of frozen peas.
But the word he used is frozen bag of peas. So I will write it according to what he has spoken.
Okay.
I will not
Okay.
change it. Okay, eight, skating.
Cycling and then skating.
Okay, cycling. I missed. Riding the bike. So riding the bike was the word according to me, or biking, riding, but ing again. Learning is about riding, biking, or maybe skating that I got. If you will ride skates, if you will ride bike, even after knowing you will lose marks. That is what it is all about. Okay. As soon as possible to wait for.
Further advice or GP.
Oh my God, this was hard. But I think they were talking about that advice for that thing.
Yes, 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 sir.
All right. And provide dash slings.
Sling,
This is
sling.
for sure correct. We'll book an appointment for an X-ray.
No, sir. Will refer to GP.
We'll refer to GP for an X-ray. All right. So 3 are wrong. I was expecting 10. But now you can understand if a person does not prepare in a nice VOET, he will lose on first. Maybe broken arm broken, or maybe he will write what doctor said, bruise, losing marks without any reason because you don't know about OET. Occurred 7 a.m. This was doable, but some people will like 7 a.m. in the morning. It's gone. Patient was, they will not put ing. Again gone. Sharp pain in, this was easy. Left thigh, most of the people will not write thigh. Again losing marks. Provided ice packs, that was easy. Ice pack for the affected areas. Patient can substitute with frozen, that was easy. So 3 blanks were easy until now, rather 2. And then patient came to resume. Again, they were not in that easy way, in the way we have done. Again, would have made it wrong. This was anyhow the nasty one. And provide sling. So 3 marks or 4 marks would have been scored by an average person. But you can take it to 9 or 10, just like we have done together in this listening. That is what is improvement if you work hard. You want to score 4 or 5, or you want to score 9 or 10 in that kind of listening. Here is a sample for all of you, for all the YouTube followers, and especially for my people. All are my
Yes.
people. Okay. But yeah, that is how you learn small things. But please try to understand and now, if you will not listen to this listening 3 times, how would you remember in the final exam? You can't. I guarantee you. And the problem is only how to manage time, how to listen to these things 3 times. That is the only problem. And you have to sort out your time. So 3 times, if you will listen to this video, you will certainly score very good in listening part A. Again, don't do too many videos. Even if you listen to all my videos of listening, that's more than enough to pass. But again, you will listen to it 1 time and that will not serve the purpose. You have to listen to it 2-3 times. This is Dr. Bhupesh once again for you, giving you complete logic, rationality, and the way and the method or the strategy or the tips and the tricks how to score the best in listening part A. Thank you very much.